Hello everyone, greetings from SHEKAR Hospital. Welcome to this YouTube session with me, Dr. Archana Singh, Senior Consultant in Cornea and Refractive Services in SHEKAR Hospital. So what are we talking about today? It's a topic which most of you will be eager to know about. And that is how to get rid of your glasses or contact lens. Your option will be LASIK. What is LASIK? LASIK is a laser refractive surgery to correct your refractive error or the spectacle power to give you freedom from glasses or contact lenses. LASIK is a safe, simple, highly precise and time-tested procedure with proven benefits. If you're an eligible candidate for LASIK, then they should be the best option for you to bid adieu to your glasses or contact lenses. Let us know more about LASIK and how it will benefit you. So what is LASIK? The full form of LASIK is laser in situ keratomylosis. In situ, meaning on site, that is on the cornea. Keratomylosis, this is a Greek terminology which means corneal carving or corneal reshaping. LASIK is a type of refractive surgery to get rid of your glasses or contact lenses. It uses a laser to treat vision problems caused by refractive errors. In LASIK, we use a laser called as excimer laser to reshape your cornea, thereby changing the curvature of the cornea as per your refractive error to correct the refractive errors. LASIK is used to treat refractive errors like myopia or nearsightedness, hyperopia or farsightedness, and astigmatism or the cylindrical power. Let me also tell you a little about the history of LASIK. The laser we use in LASIK, that is the excimer laser, was found way back in the 70s by Dr. Barker, who was a famous Spanish ophthalmologist. Later, this excimer laser was implemented in the LASIK procedure in the 80s by Dr. Payman, and he was the first to get patent for this LASIK procedure in 1989. LASIK received US FDA approval in 1995, and thereafter, over years, this technology has evolved tremendously till date and gained high precision. Let us know a little about your eye's refraction. Cornea and lens, these are the focusing elements of the eye which refract the light so that it lands on the retina. So when you look at an object, the light emitting from the object travels through various parts of our eye. It gets bent at the cornea and the lens to come to a focus on the retina, precisely on the macula. With refractive errors, light is not sharply focused on the retina as it should be, leading to blurred vision. As you can see in the picture, in the first picture, there's the eye with normal vision, that is without any refractive errors. You can see the light focusing exactly at a sharp focus on a point on the retina. Below that is a myopic eye or the eye with nearsightedness. In myopia, the cornea is more bulged or the corneas are steep and the eyeball size is bigger. The light rays focus in front of the retina in myopia. In the second picture, you can see the eye with hyperopia or farsightedness. In hyperopia, the corneas are flatter, eyeball size is smaller than the regular. The light rays, as you can see, comes to focus beyond the retina. In the picture at the bottom, you can see an eye with astigmatism. Astigmatism eyes have two different corneal curvatures. In this, the light comes to focus at multiple points. So in all these conditions, to bring the light to a sharp focus on the retina, it needs an external aid like a glass or a contact lens. So what LASIK does to the eye is, with it basically reshapes your cornea to as per your refractive error so that the light comes into sharp focus on the retina without the aid of any glasses or contact lenses. So who is a good candidate for LASIK? You should be 18 years or older. Your glass prescription should be stable for at least 1 year. Your corneas need to be thick enough and healthy, and your overall health of the eye must be generally good. For this, your eye doctor does various tests and does a detailed eye examination to see if you're a suitable candidate for LASIK. You also need to have realistic expectations about what LASIK can and cannot do for you, which your eye doctor will discuss with you in detail. So what to expect with LASIK? What happens before the LASIK surgery, or what happens when you come for the eye evaluation? We do a thorough eye examination, which includes testing your vision. We check for your refractive error, the current refractive error. What was your glass prescription earlier, which you're already wearing? Is there any variation? How stable your refractive error has been in the past 1 to 2 years? All these will be checked in detail. We also look for any other eye problems, like we do a lot of tests to rule out dryness, to rule out cataract, glaucoma, and also a thorough retinal examination before considering the LASIK procedure. The next most important thing is the corneal mapping or the topography test. This will be the confirmatory test to see if you are eligible for the LASIK procedure. The corneal topography measures the curvature of your cornea. It shows the thickness of your cornea. This is very important to rule out if there is any abnormal bulging or thinning in the corneas before considering the LASIK procedure. It also takes various other measurements of the eye like the pupil size, etc. So what happens during the LASIK procedure? It's a very safe, simple and quick procedure. It is done on outpatient basis. It hardly takes 15 to 20 minutes for both eyes together. At the beginning of the procedure, we use anesthetic drops to numb your eyes. Throughout the procedure, you're conscious and you're conversing with your doctor, listening to his or her instructions. Next, we create a corneal flap, which is about 90 to 100 micron thickness, to expose the corneal bed, following which the laser, that is the excimer laser, is used to reshape your cornea as per your refractive error. This is called as the photoablation. The actual laser exposure to the eye will be somewhere around 5 to 10 seconds. In this short period, your cornea will be reshaped as per your refractive error, and the power will be corrected. So once photoablation is done, the flap, what we have created, is put back and it will settle down by itself in few minutes. So let us see about the post-operative care. It's a very simple post-operative care. Following immediately after the LASIK, some of them experience mild watering and foreign body sensation, maybe for a few hours. And with the usage of the drops, it will settle down. The next day, all of them are very comfortable and good to go. The post-operative care is extremely simple. You have to use some drops, which includes some antibiotics, lubricating eye drops, and some anti-inflammatory drops as suggested by your doctor for the duration explained. Um, in 2 to 3 days, you can resume using your phone, laptop, reading books, driving. And in a week's time, most of your activities can be resumed after LASIK. So it is that simple. So many of our patients have shared immense happiness about their experience on the first day after LASIK. That is when they open their eyes and they see the new world without the aid of glasses or contact lenses. So that gives immense happiness to them. So after knowing about the LASIK procedure, I'm sure you will have this question in mind. Are there any side effects with the LASIK? As I told, LASIK is a very safe treatment provided it is suitable for your eyes. There are no major side effects or vision threatening problems with LASIK. Some patients can experience mild dryness following LASIK, which will settle in few days with the eye drops which we would have prescribed. Some of them can notice a little glare with the oncoming headlights in the night, which is also really not bothersome. And over time, the eye will get adapted to the new situation. So it's a very safe treatment. So are you considering LASIK? Then yes, you should definitely get your eyes checked, get evaluated yourself to know if you are an eligible candidate for LASIK. We at SHEKAR Eye Hospital have all the facilities. We have best in class technology for the LASIK treatment with highly experienced LASIK surgeons. Do visit us, get yourself evaluated, and take the benefit of this excellent technology. I hope I have explained to you about all the benefits of LASIK. So if you're a glass or contact lens wearer, and if you really want freedom from your glasses or contact lenses, then you should definitely consider LASIK as your option. Do visit your eye doctor, get yourself checked, and see if you can undergo LASIK and if you are an eligible candidate for LASIK. With this, I would like to conclude today's session. Do subscribe to our YouTube channel for many such educational videos. Do like and share it among your family and friends. We will meet again soon with many such interesting topics. Until then, take care. Thank you.